Hey, future counselor, in order to pass your addiction counselor exam, you must understand client education. In today's video, we'll define client education, discuss its purpose in the addiction counseling process, and review key concepts found on addiction counselor exams. If you're new here, welcome. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment practitioner. I provide mental health and substance use education and trainings. I also help future counselors like you study and pass their addiction counselor exams. So make sure you are subscribed so you never miss a weekly study video. Go ahead, hit the subscribe button. Okay, so now that we are study partners, let's get started. By the end of this video, you'll understand the purpose of client education and why it's an essential part of the counseling process. We'll discuss the types of information counselors commonly teach clients, including drug and alcohol education, recovery concepts, and available treatment resources. You'll also learn how to match educational approaches to different learning styles and adapt education for diverse populations to improve understanding and engagement. Finally, we'll explore how counselors evaluate client understanding and determine whether educational interventions are effective. These concepts are frequently tested on addiction counselor exams. Client education is the process of providing information that helps clients better understand substance use, recovery, treatment options, and available resources. The goal is not only to just give facts, but to help clients make informed decisions and develop skills that support recovery. Effective client education empowers the clients by increasing their knowledge, correcting misconceptions, and promoting healthier choices. On the addiction counselor exam, remember that education should be tailored to the client's needs, learning style, and level of understanding. It's important to understand the difference between client education and therapy because exam questions often test this distinction. Client education focuses on teaching. The counselor provides information, explains concepts, and helps clients develop practical skills related to recovery, health, and wellness. The goal is to increase their knowledge and awareness. Therapy, on the other hand, focuses on treatment. It involves exploring thoughts, feelings, behaviors, and underlying issues to promote insight, emotional healing, and behavior change. Client education is important because knowledge can influence behavior change. When clients understand the effects of substance use, treatment options, and recovery resources, they are better equipped to make informed decisions. Education can increase motivation, improve participation in treatment, and help clients develop skills that support long-term recovery. For the addiction counselor exam, remember that client education is a tool for empowerment. It helps clients become active participants in their own recovery process. Client education covers a wide range of topics that support recovery and overall well being. Counselors often provide education about addiction and the recovery process, helping clients understand how substances affect the brain and behavior. Other common topics include relapse prevention, coping skills, and stress management to help clients maintain long term change. Clients may also receive education on communication and relationship skills, available treatment, and community resources, and the importance of wellness and self care. Depending on the client's needs, counselors may also discuss health risks, including HIV and other sexually transmitted infections. Not all clients learn the same way. Effective counselors adjust their educational approaches based on the client's learning style and individual needs. Visual learners may benefit from handouts, diagrams, or videos. Auditory learners often learn best through discussion and verbal explanations. Hands-on learners may benefit from activities, role plays, or practicing new skills. For the addiction counselor exam, remember that client education is most effective when the counselor matches the educational strategy to the client's preferred learning style and level of understanding. Effective client education recognizes that every client is unique. Counselors should consider cultural background, age, developmental level, literacy, language, values, and life experiences when providing education. Information should be presented in a way that is understandable, respectful, and relevant to the client. For the addiction counselor exam, remember that a one-size-fits-all approach is not considered best practice. Education is most effective when it's individualized to meet the needs of the person being served. Providing information is only one part of client education. Counselors must also evaluate whether the client understood the information. This can be done by asking open-ended questions, encouraging the client to explain concepts in their own words, and seeking feedback about what was helpful or confusing. If understanding is limited, the counselor should adjust the educational approach and try a different strategy. For the addiction counselor exam, remember that effective communication is measured by client understanding, not simply by the amount of information provided. When educating clients, remember that there isn't a one-size-fits-all approach. Effective counselors tailor education to the client's learning style, literacy level, culture, and needs. Verbal methods include discussions, individual counseling, and psychoeducational groups. Written materials such as handouts, worksheets, and brochures gives clients something they can review later. Visual methods use videos, charts, and demonstrations to simplify complex concepts. And experiential approaches involve role plays, modeling, and skill practice, allowing clients to learn by doing. Counselors can also use technology-based tools, including apps, telehealth, and online resources to reinforce learning outside of sessions. Peer education draws on support groups and peer mentors who provide encouragement through shared experiences. Finally, family education helps loved ones understand addiction, improve communication, and learn ways to support recovery. For your exams, remember, the best educational method is the one that matches the client's unique needs and increases the likelihood that the information will be understood and applied. Client education can occur in several different settings. Individual education provides one-on-one instruction tailored to the client's specific needs, goals, and learning style. Group education allows clients to learn alongside others through shared experiences, discussion, and peer support. Family education helps loved ones understand addiction, recovery, and ways they can support the client. And finally, self-study encourages independent learning through readings, worksheets, recovery literature, or online resources that reinforce concepts between sessions. Now let's review a few terms related to client education. Psychoeducation, providing clients and families with information and skills to increase understanding of addiction, recovery, mental health, and treatment. An example is a counselor teaches a client how cravings affect the brain and reviews strategies to cope with triggers and prevent relapse. Health literacy, a client's ability to obtain, understand, evaluate, and use health information to make informed decisions about their health, treatment, and recovery. An example is a counselor explains how alcohol affects the liver and teaches the client how to read medication labels. The client demonstrates health literacy by understanding the information and using it to make safer health choices. Educational group, a structured group focused on providing information, increasing knowledge, and teaching skills related to substance use, mental health, recovery, wellness, or life skills. An example, a counselor facilitates a relapse prevention group where participants learn about triggers, cravings, warning signs of relapse, and coping strategies to support recovery. Process group, a therapeutic group that focuses on members' thoughts, feelings, behaviors, and interpersonal interactions to promote insight, emotional growth, and behavior change. An example would be group members discuss feelings of anger, shame, or frustration related to recovery and receive feedback from peers and how their behaviors affect relationships. Mental health education, the process of providing information about mental health conditions, symptoms, treatment options, and coping skills to increase understanding and support recovery. An example, a counselor teaches a client about anxiety symptoms, how the nervous system responds to stress, and coping techniques such as deep breathing and grounding exercises. Substance use education, the process of providing information about the effects of alcohol and drugs, substance use disorders, addiction, recovery, relapse prevention, and healthy lifestyle choices. An example would be a counselor educates a client about how marijuana affects brain function, identifies personal triggers for use, and teaches strategies to prevent relapse. Informed consent, a process in which clients are provided with clear information about services, risks, benefits, confidentiality, and their rights so they can make a voluntary and informed decision about treatment. An example, before beginning counseling, a counselor explains the purpose of treatment, confidentiality policies, mandatory reporting requirements, and the client's right to ask questions or discontinue services. Person-centered approach, a counseling approach developed by Carl Rogers that emphasizes empathy, genuineness, unconditional positive regard, and the belief that clients have the ability to grow and make positive changes. An example would be a counselor listening without judgment, reflecting the client's feelings, and allowing the client to guide the direction of the session while exploring solutions to their challenges. Question 1. Which statement best describes the difference between counseling and client education? A. Counseling focuses on exploring thoughts, feelings, and behaviors, while client education focuses on providing information and teaching skills. B. Counseling focuses on providing information about addiction, while client education focuses on helping clients process emotions. C. Counseling and client education are interchangeable services that have the same primary purpose. Or D. Counseling is used only in individual sessions, while client education is used only in group settings. The correct answer is A. Counseling helps clients explore emotions, beliefs, behaviors, and personal experiences to facilitate change. Client education focuses on increasing knowledge and teaching information or skills related to recovery, health, and wellness. B is incorrect because this answer reverses the roles of counseling and education. C is incorrect because while they may overlap, they serve different functions and have different primary goals. And D is incorrect because both counseling and client education can occur in individual, group, family, or community settings. Question 2. A counselor is providing education about treatment options to a client with a substance use disorder. Which action best supports the ethical principle of autonomy? A. Encouraging the client to choose the treatment option that has the highest success rate according to research. B. Recommending the treatment option preferred by the client's family to increase support and accountability. C. Providing accurate information about available treatment options and allowing the client to make an informed decision. Or D. Directing the client towards the treatment option the counselor believes is most appropriate based on professional experience. The correct answer is C. Autonomy involves supporting the client's right to self-determination by providing information, answering questions, and allowing the client to make an informed choice. A is incorrect because while providing evidence-based information is important, autonomy requires that the client, not the counselor, makes the final decision. B is incorrect because family input may be valuable, but autonomy focuses on respecting the client's right to make their own choices. And D is incorrect because this places the counselor in the role of decision maker rather than supporting the client's independence and informed consent. Question 3. A counselor is facilitating a group on relapse prevention. During the session, the counselor provides information about triggers, cravings, warning signs of relapse, and coping strategies. What is the primary purpose of this type of group? A. Helping members process unresolved emotional conflicts and receive interpersonal feedback from peers. B. assisting members in examining family of origin issues that contribute to substance use behaviors. C, increasing knowledge and teaching skills that support recovery and reduce the risk of relapse. Or D, allowing members to confront one another about behaviors that may interfere with treatment progress. The correct answer is C. Educational groups are designed to provide information, increase understanding, and teach practical skills related to recovery, wellness, and behavior change. A is incorrect because this describes a process group which focuses on emotions, insight, and interpersonal interactions. B is incorrect because this reflects therapeutic exploration rather than the primary purpose of an educational group. And D is incorrect because while feedback may occur, confrontation is not the primary purpose of an educational group. Question 4. A counselor is providing education about relapse prevention. Rather than lecturing, the counselor encourages clients to share their experiences, identify personal triggers, and develop coping strategies that fit their individual needs and strengths. Which principle is the counselor demonstrating? A. The counselor serves as the primary expert and directs clients towards predetermined solutions. B. Learning is most effective when clients are actively involved in identifying and applying information to their own lives. C. Education should focus primarily on correcting inaccurate beliefs through confrontation and persuasion. Or D. Clients benefit most when counselors provide detailed instructions with limited client input or discussion. The correct answer is B. Person-centered learning emphasizes client involvement, self-discovery, individual strengths, and connecting information to personal experiences and goals. A is incorrect because this reflects a counselor-directed approach rather than a person-centered approach. C is incorrect because person-centered approaches rely on empathy, collaboration, and respect rather than confrontation. And D is incorrect because limiting client participation contradicts the principle of person-centered learning. Question 5. A counselor wants to improve a client's understanding of recovery, coping skills, and relapse prevention. Which approach best reflects effective client education? A. Providing information through multiple methods such as discussion, written materials, demonstrations, videos, and skill practice based on the client's learning needs. B. Delivering information through a lecture format only to ensure all clients receive identical information. C. Limiting education to topics specifically requested by the client to avoid influencing treatment decisions. Or D. Focusing primarily on correcting misinformation rather than helping the client apply new knowledge and skills. The correct answer is A. Effective client education uses a variety of teaching methods to increase understanding, accommodate different learning styles, and help clients apply information to real life situations. B is incorrect because clients learn differently, and relying on a single teaching method may reduce comprehension and engagement. C is incorrect because counselors should provide relevant education related to treatment needs, even when clients are unaware of knowledge gaps. And D is incorrect because client education involves both increasing knowledge and helping clients use that knowledge to support recovery and behavior change. Question 6. A counselor is meeting with a client and the client's family shortly after treatment begins. The family believes addiction is simply a matter of willpower, while the client reports confusion about the purpose of treatment and recovery supports. What should the counselor do first? A. Focus exclusively on the client's treatment goals and avoid involving the family in educational discussions. B. Explore family conflicts in depth before addressing any misconceptions about addiction or treatment. C. Provide education to both the client and family about addiction, recovery, and available support resources. Or D. Encourage the family to attend mutual help meetings before discussing addiction and recovery concepts. The correct answer is C. When clients and families demonstrate misconceptions, confusion, or limited understanding, client and family education is an appropriate intervention to increase knowledge, and support informed participation in treatment. A is incorrect because family beliefs and understanding can significantly influence recovery outcomes and should be addressed when appropriate. B is incorrect because while family dynamics may be important, the immediate issue is lack of knowledge and understanding. And D is incorrect because support groups may be beneficial, but education about addiction and treatment should occur before expecting families to navigate recovery resources independently. Question 7. A counselor is educating a client about a newly prescribed medication that will support recovery. After reviewing the information, the counselor asks the client to explain, in their own words, how the medication should be taken, possible side effects, and when to contact a healthcare provider. What is the primary purpose of this intervention? A. To evaluate the client's motivation to follow treatment recommendations. B. To determine whether the client agrees with the prescribed treatment plan. C. To assess the client's willingness to participate in ongoing counseling services. Or D. To assess the client's understanding of health information and support health literacy. The correct answer is D. Health literacy involves a client's ability to obtain, understand, and use health information to make informed decisions. Asking the client to explain the information in their own words helps confirm understanding and identify any knowledge gaps. A is incorrect because while motivation may influence medication adherence, the counselor is assessing comprehension rather than motivation. B is incorrect because the focus is on understanding the information, not whether the client agrees with it. And C is incorrect because participation in counseling is unrelated to the counselor's request for the client to explain the medication instructions. Question 8. A counselor is providing education about relapse prevention to a group of clients. One client has difficulty reading the written materials and becomes frustrated when asked to complete handouts independently. What is the most appropriate counselor response? A. Continue using the same materials to ensure all clients receive information in an identical format. B. Modify the educational approach by presenting information verbally, using visual aids, and checking for understanding throughout the session. C. Excuse the client from educational activities until reading skills improve. Or D. Refer the client to another provider because educational materials are an essential part of treatment. The correct answer is B. Effective client education involves adapting teaching methods to meet the client's learning needs, abilities, literacy level, and preferred learning style. A is incorrect because providing identical instruction does not account for individual learning needs and may create barriers to understanding. C is incorrect because excluding the client from education reduces access to important treatment information and does not address the learning barrier. And D is incorrect because the counselor should first attempt to accommodate the client's needs rather than removing them from services. Question 9. A client is beginning substance use treatment and signs the informed consent paperwork. During the intake, the counselor notices the client appears confused about the purpose of treatment, confidentiality limits, and available services. What is the counselor's best next steps? A. Proceed with treatment because the client has already signed the informed consent documents. B. Review the informed consent information in clear language and verify the client's understanding before continuing services. C. Ask the client to read the paperwork again independently and discuss questions at the next session. Or D. Delay treatment until the client can explain every section of the informed consent form verbatim. The correct answer is B. Informed consent is an ongoing process, not simply obtaining a signature. Counselors have an ethical responsibility to provide education about services, risks, benefits, confidentiality, and client rights in a way that the client can understand. The counselor should check for understanding and answer questions before proceeding. A is incorrect because a signature alone does not guarantee understanding. Informed consent requires both information and comprehension. C is incorrect Because while encouraging questions is appropriate, delaying clarification may leave the client uninformed about important aspects of treatment. And D is incorrect because clients do not need to memorize or repeat every section word for word. The goal is reasonable understanding, not perfect recall. Question 10. A counselor is developing a client education plan for an individual with a newly diagnosed substance use disorder. The client reports difficulty understanding clinical terminology and becomes overwhelmed when presented with large amounts of information. What is the counselor's best approach when selecting educational resources? A. Provide resources that match the client's learning needs, literacy level, and treatment goals while presenting information in manageable portions. B. Provide the same educational materials used with all clients to ensure consistency across treatment services. C. Select the most comprehensive materials available so the client receives as much information as possible at one time. Or D. Limit educational resources until the client demonstrates complete understanding of treatment concepts discussed in session. The correct answer is A. Effective client education requires counselors to tailor resources to the client's level of understanding, learning style, readiness for change, and treatment needs. Educational materials should be accessible, relevant, and presented in a way that promotes learning rather than overwhelming the client. B is incorrect because standardized materials may not meet the unique needs, literacy level, or learning preferences of every client. C is incorrect because more information is not always better. Overloading a client can reduce comprehension and retention. And D is incorrect because educational resources should support learning and understanding throughout treatment, not be withheld until the client demonstrates mastery. Now let's review key points to remember for the addiction counselor exam. First, client education is an ongoing process, not a one-time event. Secondly, effective counselors match educational strategies to the client's learning style. Education should always be individualized based on their culture, literacy, developmental level, and other client needs. And finally, counselors must verify understanding and adjust their approach when necessary. If you see an exam question about client education, look for answers that emphasize individual learning, individual teaching, client understanding, and empowerment through knowledge and learning skills. Make sure you are subscribed to this channel so you never miss a weekly study video. For additional study resources, see the link in the description.